Good morning, everyone. Welcome back into North Dakota Today. Well, February is American Heart Month, a time to bring awareness to heart disease, the #1 cause of death in Americans. Joining us now to tell us about some minimally invasive heart procedures is Sarah from Sanford Health. Good morning.
Good morning.
Yes, we're so happy to have you this morning.
Thanks for having me.
Yes, I mean, it's Valentine's Day, but we can't just be talking about candy hearts. We got to worry about these ones too, right?
Absolutely.
Well, let's get into it. So I've heard of this thing called the TAVR program.
Yes.
Can you walk us through that?
So TAVR is, it's called transcatheter aortic valve replacement. So it's a minimally invasive way that we can replace your heart valve without having to have open heart surgery.
Okay.
So hospital stays are less. I mean, you're only in for usually about a day. Recovery time is shorter, and it's just a great way to get you guys back on your feet.
Yeah, absolutely. So has there been a significant number of patients who have been treated with this?
Yeah, so our team, we've been doing this for around 12 years or so, and we've treated about 1,700 patients.
And how important is that to, the patients not having to have that extended hospital stay?
It's so important. I mean, everyone gets so excited when they find out it's literally a day in the hospital and about a week of recovery just to let those incisions heal, and then you're back to your normal life. So they love it. It's great.
Wonderful. So I know that you guys do something too called the mitral clip. What is that?
Yeah, mitral clip. So that's for when you have either moderate to severe mitral regurgitation. So it's a leaking of your heart valve. And if you can't have open heart surgery, because there's some patients that aren't suitable for that, it's kind of like a little clip that goes onto the leaflets that can bring it together, so there's not that leaking back into the heart.
Wonderful.
So again, minimally invasive. So they're in the hospital for a short amount of time. You get back on your feet within about a week or so, and yeah.
Yeah, definitely. So why is it so important, this month, but all year round, to be so aware of heart health?
Because there's so many people that really just don't even know. And sometimes you think, well, I'm getting older, I'm 75 years old, I'm 80 years old, so I'm just tired because of that, when really it could actually be a heart issue. You could have either something like with the TAVR, aortic stenosis, mitral regurgitation, things like that.
And how does it feel for you, as a faculty member at Sanford Health, to really be able to offer this to our community?
It's so fun. This is my dream job. I have been in hearts. I worked at Sanford for 20 years. I've worked in the cardiac ICU, and so this was just kind of another stepping stone to be able to treat these patients. And it's so exciting. They become your little grandmas and grandpas and kind of your family. You get to know them real well, and so it's really fun to be able to offer this and see that excitement in their family and friends' faces that they can get this procedure and not have to go through open heart surgery.
Yeah, well, you said you've been with Sanford for 20 years. I said during the commercial break that I couldn't believe it because she doesn't look that old.
Thanks.
But how special is that too, to be with the same company for so long?
Yeah, it's really is. It's been awesome to just have the same kind of family. You get to know a lot of people, and you've been around for a long time. So there's quite a few of us that have been here for just as long, but we just, yeah, it's great.
Absolutely. So how can folks find out more information about Sanford Health and then all the procedures that we mentioned?
Yeah, so I mean the website, or you can certainly call the Heart Center at Sanford here, and someone will get you in contact with our team, and we can get you taken care of.
Wonderful. Is there anything else you'd like to share with our viewers on this Valentine's Day?
No, not really. I think that's about it.
Yes. Well, thank you so much for your time. It's been wonderful to have you on.
Thank you.
Yes, of course. All right, everyone, stick around. We have much more yet to come right here on North Dakota Today.